Hi, I'm Dr. Thomas K.L. Today, I would like to share one of our latest study. The title of this study is Surveillance Finding in High-Risk Patient After Baseline Computer-Assisted Detection Colonoscopy, a propensity score matching analysis. CAT-E colonoscopy has been proven to be significantly enhanced detection of colorectal adenoma and polyps. However, their benefit is primarily on short-term outcomes such as adenoma detection rates or the mean number of lesions detected per colonoscopy. There's still debate on whether the benefits of detecting smaller lesions and long-term cancer risk. And more importantly, the effect of the CAT-E colonoscopy on surveillance outcome for higher risk patients, for example, those with advanced adenoma, were still unexplored. The aim of our study is to try to compare the surveillance colonoscopy finding in patients with high-risk lesion removed during baseline colonoscopy with or without the use of CAT-E. The main purpose of this study is to assess the metaconus lesion rates, especially the advanced lesion, to gauge the CAT-E's role in cancer risk reduction. Our study is based on a retrospective database from Premier Hospital. We include total number of patients with colonoscopy done from July 2019 to June 2024. And we exclude those patients who have without surveillance colonoscopy done. We also exclude those patients who did not have any high-risk lesion found during index colonoscopy. The high-risk lesion was defined as any advanced adenoma, any advanced serratus lesion, or patient with 3 or more adenoma detected during the baseline colonoscopy. For the high-risk patient in index colonoscopy with at least one surveillance colonoscopy performed, we try to separate them between two groups. One group is there is already use of CAT-E during that index colonoscopy or baseline colonoscopy, and those who without the use of any CAT-E in baseline colonoscopy. That means they are using the conventional method during their baseline colonoscopy. And then we perform a propensity score matching in a 1:2 ratio. Finally, we totally recruit 54 patients who use the CAT-E during the index colonoscopy or baseline colonoscopy with high-risk lesion found during that colonoscopy, and those who without the use of CAT-E in the index or baseline colonoscopy with a propensity score match control. The primary outcome of our study is the advanced adenoma detection rate on surveillance colonoscopy. Advanced adenoma detection rate (AADR) was defined as the proportion of patients with at least one advanced adenoma detected. Other secondary outcomes would include adenoma detection rate, serrated lesion detection rate, advanced serrated lesion detection rate, the number of adenoma per colonoscopy, the number of advanced adenoma per colonoscopy, the number of serrated lesion per colonoscopy, and number of advanced serrated lesion per colonoscopy. This busy table summarizes the cohort before and after propensity score matching. And we can find that after propensity score matching, the two different arm was well matched for baseline demographic including age, sex, smoker, and drinking status. And also the comorbidity include the incidence of diabetes, hypertension, hyperlipidemia, coronary artery disease, chronic renal disease, and history of cardiovascular events, as well as the medication use including aspirin, statin, metformin, and the family history of colorectal cancer. And we also try to match the baseline colonoscopy finding, including the bowel preparation score, referral time, the proportion of patients who have experienced endoscopy, and the type of endoscopy we are using, and the finding including the ADL, AADL, SDL, ASDL, as well as the mean number of lesions detected respectively. We also try to match during surveillance colonoscopy the baseline characteristic, including the withdrawal time, the proportion of experienced endoscopists, the use of endoscopy, as well as the mean surveillance intervals between the baseline colonoscopy and also the surveillance colonoscopy. We found that AADR and ADR were significantly lower in patients who have a CAT-E at baseline colonoscopy than with the conventional colonoscopy. You can see that in this table, the advanced adenoma detection rate for CAT-E is only 11.1%, and for conventional colonoscopy, that is the colonoscopy without the use of CAT-E during the baseline colonoscopy, is 24.1%. And the number of adenoma and advanced adenoma and the number of adenoma were also significantly lower in patients who have CAT-E colonoscopy done during the baseline colonoscopy than conventional colonoscopy. As you can see that in this table, the mean number of lesions, that is the mean number of advanced adenoma, is 0.1 detected at surveillance colonoscopy if they are using the CAT-E as in the baseline. If they haven't used the CAT-E as baseline, the mean number of advanced adenoma detected during the colonoscopy is 0.3, and they are significantly lower in CAT-E group. And we found that the cumulative incidence of patients with metacolon lesion or surveillance lesion was significantly lower in CAT-E colonoscopy group than conventional colonoscopy group during follow-up with a long-range test p equal to 0.05. In summary, the current study supports the potential positive impact of CAT-E colonoscopy on reduction of metacolon lesion, including advanced adenoma during surveillance colonoscopy. However, during the limited sample size, our team still think that further large-scale prospective studies are needed to address the role of CAT-E on PCCLC development as well as the metacolon lesion development.